Hi, I'm Dr. Dan Maddock, and I'm here with Dr. Dan Tuttle. Dan, you were asking me a question about global torque technique. What is your question?
My question is, what do you do with your fingers on the contact with your left hand here? I know the thenar contacts the zygomatic and the frontal, but I don't know what the fingers do.
Well, here's your anterior contact here. For the patient's head is turned to the left. You're going to contact the zygomatic, superior zygomatic ramus and the frontal ridge here, just anterior to the coronal suture. So your contact is like this.
That makes sense.
Now, on the opposite side, you're going to contact here on the occiput, just posterior to the occipitomastoid suture.
So you don't cross the suture?
You do not cross the suture because you want to separate, and you're going to have the patient turn their head this way as you resist this way.
Okay.
So what you're doing there is you're stabilizing the head and you're rotating the cervical spine, so that what you're doing is you're torquing the dura, you're torquing the tentorium, the falx cerebelli and the falx cerebri, and you're torquing the cranium, and that contact this way while you're resisting this way affects the intracranial dura. So the patient turns the head to the right, or to the right, and you're resisting in this direction to stabilize the cranium. And then you're going to switch and you're going to bring your contact here onto the occiput, again posterior to the occipitomastoid suture, and you're going to have the patient again turn their head to the right, and this hand is going to contact here and draw anteriorward, while this one pulls posteriorward in the direction that the patient is turning their head. So you're separating all these sutures. You're separating the entire lateral cranial sutural system, and then you reverse, and so you're pulling forward in the direction that the patient is rotating as you contract here, and you're opening up this posterior occipitomastoid and lambdoidal suture. Does that make sense?
Yes. Is there any anterior inferiority here, or is it just straight anterior?
It's straight anterior, rotation, rotation.
Okay, okay. And the fingers... These fingers
just
are just hanging out.
Contact. Here's your contact here, here's your contact here, or here's a contact here, and here's a contact here. So here, this way, right, left, this way, right, left. Then you turn the head in the opposite direction, grab a hold here on the anterior portion of the cranial vault, anterior to your sphenozygomatic suture and your sphenofrontal suture, and you're contacting here and on this side over here with fingers again posterior to the occipitomastoid and the lambdoidal suture, and rotating this way and this. You're rotating this way, and then contact here and have the patient turn their head very gently, very slowly. Doctor gauges how much rotation and how much pressure is put in by what he feels at the release, and it's inhalation, exhalation, and rotation right and left.
Sounds good.
All right, thank you.
And for legal purposes, I am not a doctor until June 16th, and am not licensed to practice in Florida yet.